stop it, I'm not a boy, I'm not a girl, someone's made a mistake here. I don't know why you keep saying to me, come here little boy, because I see the girls and that is who I see myself. It feels really wrong for that child. Teachers don't know what to do, parents are finding it very difficult. Anybody who is negating that child's true sense of self is harming your child. You cannot grow out of being transgender. If they are not willing to go through that learning curve with you, then they're not safe to be in your child's life. I'm Dr. Helen Webberley. I'm a gender expert and a medical educator, and I'm going to be answering all those questions that come to me every single day from parents and families and people who are navigating living with transgender children. I think the way that I've always described this best, I think, is when you've got a baby or like a 1-year-old and you give them a mirror, they will see something in the mirror and they'll see something in the mirror moving, but they don't actually see that it's themselves. They don't know that that is them. They don't know that's who they are. They can't see it. They can see something in that reflection, but they don't know that it's actually them. And then when they get to maybe 2 or 3, they would start understanding, oh, that's me. That's me looking back at me, and they understand themselves as a person and they start understanding their sense of self. And then they see other children and they realise that they're a separate identity to those other children. And then, for example, if you have a child who has a birthmark on their face, for example, they will start to notice that they've got this birthmark on their face and other children don't necessarily have that birthmark. So they will notice that that maybe they are different in some way to some of the other children. And so that's when they start noticing differences and actual self-identity. That if you're saying, come here little boy, and they're like, well, I can see all the little boys over there, I can see who they are and what they do, and that doesn't match with me. I don't know why you keep saying to me, come here little boy, because I see the girls over there, and that is who I see myself as. So that group, that community, the way that the girls play, the way that the girls skip and jump and laugh and play together and act and behave and exist in this world. And they say, no, that group fits me much better. I don't think I should be a boy. I think I should be a girl. I don't know why you keep calling me a boy. I know I've got that body that looks like the other boys, but it doesn't match me. And so you can see that the language starts developing, the sense of identity starts developing, the realisation that you are a separate person, and there is a group connection, but not that group. That's not the group that I belong to. That's the group that I belong to. And then, of course, children will start to vocalise and say, stop it, I'm not a boy, I'm not a girl, someone's made a mistake here. Can I go back in your tummy and come out again differently? Can you get me my willy for Christmas? This is all wrong. I don't know what's happening. This is not right. And all of those questions, all of that expression, all of those thoughts, is so important to listen to them and talk to them. There was some very cruel research done back in the day, and what basically they did was they looked at lots of young children and they looked at what they liked to play with. So literally had a bunch of young kids, saw what they played with and said, well, you know, that's a boy and that boy's not playing with trucks, he's playing with dolls, and vice versa. And then they watched those children as they grew up, and then that little boy didn't play with dolls anymore, he ended up playing with trucks and he ended up being a boy. But what they said was that these children were transgender in some way and they grew out of it. But they weren't. They were just young kids who were choosing what they wanted to play with that day or what they wanted to wear that day. And it's very, very different from a child who is insistently and persistently saying, I am not a boy, I am a girl. And that's very, very different from just allowing children to freely play with whatever they want to play with and just be kids and be happy. So you cannot grow out of being transgender. Your gender identity is fixed from conception. Obviously, we don't know what it's going to be until you are old enough to tell the world which gender identity fits you best. Which gender role, if you like, that we have constructed, which label best suits you, which one do you feel you identify with? And until that person's old enough to tell you or old enough to think it through, we don't know. But you can't grow out of that. But what they did was they looked at these kids who were just playing and said, look, see, that kid's playing with a truck. And he ended up, and she's still a girl. You know, she didn't turn out to be transgender. And it's because she never was transgender. She simply was a little girl playing with a truck that day. If you've got a school where the boys line up in that queue and the girls line up in that queue, and you've got a little what you think is a girl, but she is saying, I'm not a girl, I'm a boy. It feels really wrong for that child if they feel that actually they're a boy and not a girl. It's really difficult for them to line up with in the girls' queue. But then the teachers and the parents are like, why is that girl lining up in the boys' queue? And it's like, because actually he is a little boy, even though everyone else thinks that he was going to be a little girl. Actually, he is a little boy. And schools have a really big, important part to play in accepting and supporting transgender children. And I know it's difficult at the moment. I know schools are finding it difficult. Schools are getting advice from other places and other people who don't understand gender identity. And schools are being told that we shouldn't encourage it and that we should be very careful about letting children explore their gender and see what it's like to be in the boys' queue and not the girls' queue. And teachers don't know what to do. They're being told one thing by one person and another by another. And parents are finding it very challenging. Then they go to school and say, I want my child to stop wearing the girls' uniform. I want my child to start wearing the boys' uniform. I want you to stop calling them by that girl name. I want you to use their new boy name. I want you to stop calling my child she, because my child feels much more comfortable if we refer to my child as he. And that's the parents' wishes, that's the child wishes, but then the schools are finding that very difficult. And some schools are actually against it. You know, we've got some teachers saying that it's their religious right to not use someone's new pronouns and name. And at the end of the day, we've got all these adults talking over the children, and what actually hurts is the child. Imagine a child saying, you know, an older child saying, I'm gay and I don't fancy girls, I fancy boys, and everyone's saying, don't be stupid, of course you must fancy girls. And it's like, well, I don't, and you've got to listen to me. And, you know, negating somebody's identity, or telling somebody that they're being stupid, or telling somebody that they shouldn't feel that way, telling somebody that they're not allowed to be themselves, it's just incredibly hurtful. What we need to go back to is policy. You know, does your school have a equality, diversity, inclusion policy? What does the policy say? Does the policy say that we respect all people, we respect all ages, we respect all religions, we respect all races, we respect all levels of ability, we respect all people's sexual orientation, and we respect people's gender identity, and we respect people who are either considering undergoing gender reassignment or actively undergoing gender reassignment, or who have completed their gender reassignment. Does your school policy say those things? Because you need one. That's what the Equality Act is all about. So what does the policy say? Is it inclusive, and are they following their policy? And that's a really good place to start when schools don't know what to do with transgender children. And then people worry about the EHRC guidance, which has recently, it's out for consultation at the moment. It's only a draft, it is out for consultation. Lots of people are telling the world how uninclusive it is, because it's saying things like transgender girls shouldn't use the girls' toilets, and transgender girls shouldn't be able to sleep with the other girls on school trips, and transgender girls, you shouldn't encourage them to live in a female gender identity. We should be stopping them for some reason, and it's just absolutely atrocious, and we need to challenge it. And what we need to remember is the child is the most important person in that room, in that school, and that's who we need to make sure has the best education and the best opportunities ever. It's very difficult when your child comes out, because you may or may not have been expecting it. It may be a complete shock, or you may have thought, actually my kid's going to turn out to be gay. But It's the challenges that society will throw at you along the way. And one of those challenges can be other family members, whether it's grandma, grandpa, auntie, uncle. But again, you know, anybody who is negating that child's true sense of self, who they really are, how they identify. Anybody who is negating that is harming your child. And we can teach. So you had to go through a learning curve as a parent, and so will Uncle Joe have to go through a learning curve as an uncle. And if they are not willing to go through that learning curve with you, then they're not safe to be in your child's life. And that's how it is. Okay, so we used to call it gender dysphoria, we used to call it transgenderism, we've sometimes called it transvestitism, and the modern way to refer to it is either gender diversity, which kind of incorporates a whole spectrum of gender, or gender incongruence, which I sometimes feel is a little bit cruel, but it's what we use in the medical world. And the incongruence means it doesn't match. And so basically when your child is born, somebody has a look down below and makes the best guess about what gender your child is going to identify with later in life. And it's a very easy guess. And for the majority of people, that's how it works out. But for some people, they may have, for example, XY chromosomes, which means you have penis and testicles as your reproductive system. But actually, the way that you end up wanting to live your life, the way you see yourself, the way that you wish the world to see you, the way that you want to live and exist in the world, is much more on the female side, or what we associate with the female side. So is it real? It's absolutely real. Not everybody who has a penis and testicles identifies as a boy, and completely the opposite. Not everybody who doesn't have a penis and testicles, who has an ovarian reproductive system, doesn't. Not everybody identifies as a girl. It's very real. Some people will tell you that they don't identify as either, and which is what we call non-binary. So some people don't identify as a boy or a girl. They just don't see themselves. It doesn't fit them. What we describe a boy to be, or what boys like doing, or how boys think, how boys act, how boys live in this world. And some people just say that just doesn't describe me. And the same with girls. And some people say neither. No, I just don't fit neatly into either of those boxes. Or some people say, well, both of those suit me. So people sometimes mock and talk about, you know, how many different genders are there. But maybe that gender identity is just a spectrum. And sometimes you've got very, very feminine people that side, and very, very masculine people that side, and then all the kind of variations in the middle. But is it true? Certainly some people do not identify with the gender that everybody expected them to be when they looked at that little baby being born on that day. It's very real. You can't do anything about it. You can't change it. You can't stop it. You can't make somebody identify as a gender that just doesn't fit them. It doesn't work. So there's a lot of talk about, was it in some way childhood trauma that caused your child to have a different gender identity? And, you know, we've seen some famous cases where someone says, well, I was just pretending to be trans, or I thought I might be trans, but actually it's because I was just having a difficult time. Gender incongruence is very real. It's absolute. And you can't cause it. So yes, maybe there will be some children and young people who have had traumatic experiences in their life, because sadly that happens, and they also may be trans. But that trauma never ever causes your child or your person or you to be transgender. It just doesn't work like that. And then other people will say, well, you know, that little girl was sexually abused by that person. And so what she's done is she's refusing to be a girl anymore because her sex let her down, if you like, and so she now wants to be a boy. And again, it just doesn't work like that. You know, yes, sexual abuse is very, very, very traumatic, but it doesn't make you a boy, and it doesn't make you want to be a boy. They're very, very different. But you will get people who have been sexually abused who are also transgender, and we mustn't confuse the two. Both deserve this attention and support and love and care, to help that person live their life. Then other people will say, what about autism? There seems to be ever such a lot of autism in people who are transgender. And yes, there are people who are autistic and there are people who are transgender, and there will be an overlap. And then people will say, but there's a bigger overlap. Is it more likely that if you are autistic that you are also transgender? And I personally think there's two reasons for that. One is that people with autism classically have difficulty with social relationships or in society, and that's kind of what classic autism is described as. Now, if you are transgender and everyone is saying you should be in the girl group, not the boy group, but everyone's pushing you into the wrong group, then that also causes difficulties with social interactions, because everyone's expecting you to play football with the boys, but actually you ought to be playing with the girls. And so you don't fit in with the boys, but then when you go over to play with the girls, they're like, well, you shouldn't play with us because you're a boy. And that causes difficulties for children who are growing up. And what those difficulties can do is make social interactions difficult. So there's a lot of overlap in the symptoms or the characteristics of autistic children and transgender children. Whether that's just a misdiagnosis or not, we don't know. It seems to me that people are very ready to diagnose somebody with autism, but terrified of diagnosing somebody with gender incongruence. In the olden days, if you were transgender, you just had to put up with it. And if you speak to trans adults now, puberty was very painful for them, because you may have been living your life very happily as a girl, but then puberty comes along and it gives you away completely. But more recently, certainly since the 90s, we've realised that actually you can do something about it. When puberty starts, you can actually give medicines to stop it. You can stop the ovaries and testicles from producing that hormone. And then when the child is ready, you can actually give them the opposite hormone, so they go through the puberty that actually does match their gender identity instead of the wrong puberty. And I make it sound so simple because it is so simple. And it was going really well. We've had a decade of transgender children who've had access to puberty blockers and then gender-affirming hormones or cross-sex hormones, the other hormone, to give them the puberty that does match their gender identity. And it's been life-changing for them. Their bodies have done what they wanted them to do instead of the opposite. But now we have politicians, we have radical feminists, we have people who are opposing gender affirmation, and people who are telling all kinds of lies. And so there have been pauses and blocks and barriers to accessing gender affirming care, particularly for young people, which means now, as we stand at the moment, certainly in the UK, that young people can't get access to those medicines that turn their testicles off or turn their ovaries off. And now people are campaigning to stop them having the hormone that matches their gender identity instead. And so they're going to be forced to go through the wrong puberty, and their bodies are going to change in ways that will be very painful for them. And I feel devastated, and the tragedy that is happening to those families and young people. But the politicians got involved, people who have alternative views about gender identity got involved. Not the true experts have made some nasty conclusions about gender affirming care. And we are where we are at the moment, that it's very difficult to access that care. And we're kind of back in the 50s and 60s where puberty is going to do its damage. And then those people who've gone through the wrong puberty, if you like, are going to spend many, many years and surgery, money, time, pain, trying to reverse those things that could so easily have been stopped if we'd listened to the medical experts. It's an interesting one because if you're a cisgender teenager, and puberty is late starting, round about the age of 14 or so, we say, well, why haven't you started puberty yet? Really, we would like you to start puberty by 14. 15 is too late and 16 is too late. And it's too late for several reasons. One is the physical side. Sex hormones are really, really good for your bones. And so if you haven't started your sex hormones, i.e. you haven't started your puberty by 14 or 15, your bones start suffering a little bit. And as soon as you give the hormones, as soon as your puberty starts, your bones then start recovering and they get big and strong and adult. And puberty blockers do that too. So if you give puberty blocker to somebody who is 11 and then you leave them on the puberty blocker until they are 14 or 15 or 16, the same thing happens because you've stopped their hormone production. You've put them into late puberty, if you like. And the same thing to happen. The bones are like, excuse me, can I have my sex hormone now? So puberty blockers can make bones go, I need my sex hormone now. And the easiest thing to do then is make sure that child has hormones. And they've got two choices. Either they stop the blocker and let their own hormone come back into place, or they have cross-sex hormones and they're given hormones as medicines. And then the bones go, thank you, cool, I can now become my adult strength. So that's the bone situation. Puberty blockers don't cause bone thinning. It's the lack of hormones that the bones need that is the problem. And then the other thing that puberty is really important for is psychological and maturity. And we don't want teenagers going through a very late puberty, because when you go through puberty, that's when you start doing all your risk-taking behaviour, and that happens as your body is maturing into adulthood. And we want that kind of risk-taking behaviour to take place when you're safely in your home with your family and your parents, and they can look after you and manage your risk-taking behaviour, if you like. And so that when you come out the other end of adolescence as an adult, you've been there, done it in the safety of your own home. But if we delay that too much, and this was a problem with delaying care for transgender children, is you put them on puberty blockers and then you say, well, I'm not going to let you have your puberty until you're 16 or 17 or 18, and then that's too late. And what we've got is transgender children going through that adolescence at university or college, or outside the safety of the family unit. So basically the principles of care are make sure that the child has the same pubertal development, whether they are cisgender or transgender. Doesn't matter. We need puberty, we need the right puberty, and we need it at the right age. And that's what's essential. Society and politics have been a nightmare recently in getting involved in these kinds of decisions. And so very often when parents take their children to the doctor, or when someone goes to the doctor, it's just a huge challenge. The medicine's there, it's so available. All the other people are having exactly the same medicine, just for a different reason. It's there, it's accessible, but getting someone to help you can be very, very difficult. And then you've also got other doctors, counsellors, psychologists, social workers who will think that, in some way the child is being harmed or abused or coerced into doing this. And then maybe even think to take action against the parent for supporting them in their gender identity, which is really sad. But it comes down to policy and guidelines. What's the inclusion policy at your GP surgery? What clinical guidelines are they following for diagnosing and managing and treating gender incongruence? Let's have a look at what your practice policy is. Let's have a look at the training that your doctors and nurses have had in this area. Get your decisions in, get anybody who's refusing to help or taking action against you, get their reasons in writing, not just over the phone, and just gently, calmly and evidence-based challenge it. And I spend quite a lot of time on my website writing about policies, giving template letters for people to ask those very questions from the professionals who are supposed to be helping them. I'm aghast to see that there's actually now a detransitioners day. But what we have to actually ask people is, what is it that you regretted? Do you want to put your birth certificate back to how it was when you were born? Do you want to change your name back, either just by what you tell everybody or by deed poll? You can do that. Do you want to undo your passport or driving licence and put your birth gender back on there again? Or surgery. Some people had surgery that they regret for some reason, and they want to undo that, and you can see whether the surgeon is able to undo that surgery in whichever way that suits you. Medically, you can say, okay, I don't want this hormone profile anymore. I'd like to go back to my original hormone profile, and that's fine. Stop taking the Stop taking the replacement hormone, stop taking whatever's blocking your natural hormone production, and go back to your natural hormone production. That's absolutely fine. And of course, just change your name, change the way you look, change the way you dress, change the way that you want the world to see you and the way that you want to live in the world. And that's absolutely fine. It's your personal choice, but what we shouldn't be doing is shouting politically about it and restricting care for everybody just because you want to untransition in some way. That's your choice. That's absolutely your choice to do that. Or what we shouldn't be doing is blocking everybody's access to gender-affirming transitions simply because some people regret their transition. And if we look at why people regret their transition, and obviously in medicine we've researched it because we always want to make sure we're doing the right thing for our patients. And actually it isn't because they weren't transgender in the first place. It was mostly because society is mean and nasty to transgender people at the moment, and being a transgender person can be very, very difficult in today's society. And some people are like, do you know what, I just can't do this. I can't do this anymore. I can't live as a transgender person. I want to go back to pretending I am a cisgender person. So the regret, if you look at it scientifically, is always regret because society, family, the world doesn't accept gender incongruence in the way that it should. And then you will find one or two fringe cases, like you always do, and those are the ones being popped up on a pedestal at the moment as famous detransitioners. But those are so small. And maybe that they consented to have procedures done or to take medicines when they weren't actually truly transgender, but nobody forced it upon them. They accessed care, they wanted care, they signed consent forms, they took those hormones for a very long time. And I don't know whether we'll ever get to the true bottom of all of that and the true motives behind being such a famous detransitioner, if you like. But what we have to just understand is that is the most minuscule portion of this, and it must not be a barrier and a blockage to other people accessing the right care for them. Thanks for watching, thanks for listening, and don't forget that I write about this all day, every day on my website. Come and have a visit, I'll see you there. Link is below.